Hi, I'm Dr. Rajani, and today I'm telling you my #1 treatment for all natural brow hair growth. Now, everyone on this channel often comments, Rajani, you need to take care of your brows, shape them, pluck them. I'm a guy, I'm just happy to have hair. I'm happy to have hair in my head. I'm happy to have brow hair. But for a lot of women, they come into my clinic, they want more hair along the brow because it frames the eye. It looks youthful, but it's also trending. I'm going to tell you my #1 most natural treatment to restore it, but first we'll go through a few quick causes that you need to be aware of hair loss along the brows. I'm going to tell you my #1 most common one. Then I'm going to go through a couple popular treatments, and then I'm going to tell you my #1 most natural way to treat and restore. If you like these videos, click like. Remember to subscribe. Now, there are many causes of brow hair reduction. We call it alopecia, means loss of hair. Thyroid, a lot of women get their thyroid checked anyway. So when I ask them, hey, what's your thyroid? Do you know? We measure screening tests as a TSH. Most women know that, what it is, and they get it done with their yearly checks. But thyroid's one you want to think of. Nutrition, very rare to have a nutritional deficiency, but you'll hear people taking zinc and supplements, biotin and different things. The third one, a lot of people who are prone to having eczema or atopic dermatitis tend to lose a little more hair. The #1 most common one, there'll be two things. The top two most common that I see, one is menopause, hormonal changes that can lead to that. I'm thinking more along the lines of estrogen, progesterone, testosterone, and that balance. So that leads to thinning of the hair. And of course, the trend, my generation, prior plucking, threading, removing the hair, and that led to scar tissue. So now they're left with thin brows. The hair doesn't grow back as bushy, as robust as it was. My treatment tends to work for even those people. What are some of the things commonly done? I see people using minoxidil or Rogaine on the hair region. Latisse, which is used for lash growth, and the Latisse-like products. Bimatoprost is the active ingredient in Latisse, but there are analogs, and sometimes even that ingredient is used in knockoffs in different ones, so be careful what you get. But it was a glaucoma medication when people were using it for glaucoma or increased intraocular pressure, so pressure in the eye that can lead to blindness, headaches, and other problems. And they found those patients had increasing lash growth. And that's how it worked. People then take the same applicator and we're using it on the brows, and the brow hair grew. So it does actually work up there. And of course, we always hear, is it being studied for the hair on the head and so on? I'll do a complete video on that. Many things have been tried, including taking hair follicles and actually growing more hair in petri dishes through stem cells and so forth. So those types of products can be used to grow brow hair. However, they're not all natural. My #1 all natural solution is plasma brow. What's that? I take the blood, spin it down, slow spin speeds, no additives, nothing else in the tube, and you can take the layer at the top, which is high in platelets, white blood cells, mesenchymal stem cells, those healing factors that help heal the body, and inject it with a micro cannula above the brow. What this does is wake up dormant cells. It helps improve hair growth, and I do it as part of my full face procedures because I use PRF under the eye. I use it with Sculptor or PLLA in combinations, and I use it to microneedle into the skin. We also use a gel form now, or a more robust form, heated albumin from the body, to use it in a filler type of format. So these treatments are all evolving. However, I've done it in the brow along with the under eye, plasma eyes, for a long period of time. And why not? Because we were doing the under eye, we were finding tightening of the skin, brightening of the under eye. I would grab it and treat the brow, and the brow hair was growing back, and now of course it's a trend. So plasma brow is very common in my clinic. Now if people want an extra boost to that, you can add something called A-cell or cellular matrix, commonly used after hair transplant, in follicular unit extraction, even strip hair transplants. But for using it in the brow area, that can be done as well. If you're using microneedling, many people know microneedling, PRP, so the new generation, the PRF that I'm talking about, can also be used for hair growth on the head. So there's many solutions to improving brow hair. I put a complete playlist up here on platelet-rich Vibrant and those types of procedures, and one down here for skincare tips you can do at home to keep your skin and body beautiful, healthy, and vibrant.